having me here. Can you guys hear me okay? Okay. Uh, my name is Colleen Rahn, and I am the Education Director at NAMI, Montana. I've been there for about 6 years. Before that, I have lots of experience in the working with mental health in the mental health field. So NAMI, Montana is probably one of the really very interesting, not a dull moment of the job, which is what I like. All right, so imagine your child has a mental illness. You take him or her to the doctor, and you're told that your child's illness is your fault. NAMI was founded in Madison, Wisconsin in 1979. When two women got together around the kitchen table, they were both caring for their sons who were diagnosed with schizophrenia, and they were just tired of being blamed for their son's illness. The National Alliance on Mental Illness, NAMI, was formed when these two women got a group of people together who were unhappy with the lack of services available and the treatment of those with mental illness. So what is mental illness? Well, according to Tom Insel, who is the director of the National Institute of Mental Health, mental illness is a chronic disruption of the neural circuits that affects a person's thinking, feeling, mood, the ability to relate to others, and daily functioning. Mental illness is also a medical condition that often results in the diminished capacity for dealing with the ordinary demands of life. So why do people have mental illness? So there's a diathesis stress model. I don't know if you guys have ever seen it, and I didn't bring my PowerPoint, so I couldn't show you, but it explains the brain health. So there's biological susceptibility, and then there's environmental factors that are included in mental illness. So biological susceptibility is kind of like genetics or family history. Pediatric maybe infections or illness, prenatal injury, or substance abuse, like maybe moms using drugs while pregnant. And then you have the environmental factors, and those are like trauma and abuse, stress, drugs and alcohol. Now, some people are more susceptible to mental illness with these factors. So let's say you're susceptible to getting a cold if you're around someone that has a cold, as opposed to someone with a different immune system. Or the same with like cancer and heart disease in your family. If it runs in your family, the chances are greater that you're going to get it. Now, there is no cure for these disruptions in neural circuits, but recovery is possible. There's positive environmental factors, such as psychiatric treatment, therapy, peer support, family support, good sleep, diet, and exercise. Those all contribute to recovery. So let's talk about, so I kind of gave you what mental illness is, and the history of NAMI. So I'm going to start talking about, I said that NAMI, our mission is to support, educate, and advocate for people with mental illness and their families. So how we provide the support for people. We have informational videos on our website that kind of touch on the mental illnesses. We have a plethora of stuff on our website of information about all different sorts of mental illnesses, to include the ones that were talked about before: schizophrenia, depression, bipolar, anxiety. We also have a mental health resource guide for all 56 counties. That's really beneficial for me because when another way that I provide support is people call the office all the time. It could be a family member really concerned about a loved one's behaviors. Maybe they're new to mental illness and they're trying to figure out what do you do? What are the steps do I take? Or there's a person that people call with mental health conditions. They're having symptoms and they don't have care or something. So I kind of help them navigate the mental health system. And most of the time, I just listen to people when they need someone to tell their stories to. Which happens quite a bit. And because it's really navigating the mental health system in Montana is fairly difficult. You know, I get a lot of phone calls from people who have a loved one who is an adult and they're not taking medication and they're exhibiting these behaviors that necessarily aren't a danger to themselves or others, but they're kind of bizarre and worrisome for the family. And there's nothing I can tell them to do, you know, because their loved ones are adults and they can't force them into treatment and they can't force them to take their meds. And so it gets challenging, you know, with that scenario, which happens quite a bit, which is unfortunate. So NAMI Montana also provides education for people with mental illness and families, and NAMI has kind of a structure to their programs, their education programs. So we have Family to Family, which is an 8-week education course. So it's kind of a commitment. It's usually, they're like 2.5-hour classes once a week for 8 weeks or however long the trainers want to, however they want to set that up. And family support groups. And those are for family members with loved ones. And then we have peer-to-peer education classes, and we have a connection support group. And that is designed for just people with mental illness. And these are trained and taught by and facilitated by people with loved ones or people with mental illness. We don't kind of intermix or intercombine those because sometimes people don't, if they're in a group, a support group with a family member who has a mental illness, I don't think they feel as good about being open and honest about what they're going through if their loved ones in the room. So that's kind of a NAMI structured way to run those groups. We have NAMI affiliates around the state. We have one in Billings and in Bozeman, Flathead. We have one in Great Falls, Havre, Helena, and Missoula. And there has been interest in creating an affiliate. We want to call it like the person that wants to do it lives here in Butte, but he wants to call it like Southwest, NAMI Southwest, to encompass little rural towns around Butte, which I think is amazing. So we're working with that person to get this started here. And then I got approached by some people in Jefferson County in Boulder that want to start one as well. So we're working on that. Oh, and I wanted to say that the family to family and family support and peer to peer and the peer support aren't the only programs that NAMI has. We have what's called a family and friends seminar that we do every single month. It's a 2-hour seminar and we do it on Zoom so it can be statewide, so people can zoom in from like Miles City or Sydney or like a rural town and kind of get information and help. Well, information, it's a seminar, so it's not really a back and forth thing, but at the end we usually like answer questions, and I usually I host it, so I manage the chat box and try to answer questions. But yeah, so we have that program, and in NAMI Billings they do NAMI Basics, which is a 6-week program for caregivers of people with mental illness. And then they have Ending the Silence, which is something that you can take in schools, you can do in schools. They have in your own voice presentations where it is two people with a mental illness that kind of talk about their mental health journey, and it's very effective. It's really helpful, and they go around and like people ask them to come and talk about that or do it in your voice presentation, like it's something like this, or they go into the colleges, like my NAMI Missoula people go into the college and talk to the departments there. So it's really nice that people are able to present NAMI in that way in those communities. So NAMI Montana provides advocacy. We are a very strong voice in legislation. We assist with writing bills that pertain to mental health. We attend and we testify at the legislative sessions. We helped develop helped develop the HEART Act or the HEART Bill with the marijuana tax money going to the crisis care. So that was one of the successes that we have been able to do. We also worked with the legislator on developing interim studies for the mental health system, the child mental health system and the adult mental health system in the state of Montana. And they have been meeting like every 4 months on that. And we are always present at those committee hearings, and we testify and are very active in that as well. We were helped write the national bill, the Scott Hannon Veteran Suicide Prevention Bill, John Scott Hannon, and that was passed and signed by Donald Trump. And that was something that we were able to do on a national level, which was pretty amazing. NAMI Montana developed a TripAdvisor-like program. It's called Treatment Scout. And what you can do is you can go on the website and you can look up any kind of treatment center for substance abuse and mental illness. And the really neat thing about it is it has Google reviews. So you can like look up a treatment center in Idaho or Maine or New York, and you can read their reviews on what they are, so that you can ensure that you are able to find a treatment center that's best suited for yourself or your loved one. You know? So that's kind of a little thing that we've done. We've also worked with the MSU's Research and Recovery Program to bring evidence-based youth suicide program to Montana from Sweden. And we were able to bring it here in like 2016, and it's a 5 hour, so we do it in 3 weeks or 2.5 weeks to freshmen in high school, and it's an interactive. It's kind of role plays and a lot of discussion, a lot of dialogue, a lot of experiential stuff with the kids, and so it's kind of a different program. But it is in Sweden, it was evidence-based. It cut down the suicide rate. I don't think so far that we have those numbers for Montana, if it's that, but that's pretty. I'm actually an instructor for the YAM program, so I was able to go into I was able to go to both high schools in Helena this year and teach the freshmen, so that it was pretty amazing. Every year we have an annual conference, and we have our conferences in a different city every year. The last 2 years we haven't been able to due to COVID, because we haven't been able to do anything in person, but this year we're going to be in Kalispell, and those are generally in the fall, in October. And we're trying to get some good presenters. We usually fly presenters in that are going to be, that you want to listen, like you want to hear. So the last 2 years, I said we couldn't really have it in person, but what we have done is we've done webinars, monthly webinars, and we've had really good people come and talk about treatments like ketamine treatment or different kind of treatment for mental health. In May, May 11th is our final one that we're doing this year, and Dr. Tom Insel, who I referred to earlier, he is going to be on that webinar. So, and I just to let you know, everything that we do at NAMI, it doesn't cost anything. Like if you get on those webinars, you don't have to pay anything. To come to the classes or the support groups, there's no cost. We pay for stuff, so we pay for everything. And that brings me to talking about how are we able to pay for all this stuff? And that's our NAMI awareness. So we have a NAMI walk every year, and that's our biggest fundraising event. All the money that we get is spent in Montana. We either can help our affiliates with their training needs or their program material needs if they have a class in their community. NAMI Montana has 2 staff members, me and my boss, so thanks for that. And we have such generous donors, people that donate, not at the NAMI walk all the time, but we also have people that donate and they specifically want their money to go to Treatment Scout, or they want it to go to YAM, or they want us to to spend it on certain things. Some donors do request what they want their money to go towards. So we make sure that the money all stays in Montana, and that people in Montana and their families are benefit from our donations that we get. So for the NAMI walk, I said it was like I said before, it was our biggest fundraising event. And the reason why we do that is to fight stigma against mental health or mental illness. It helps people realize that recovery really is possible. And just to let you know that you're not alone. And it's a pretty fun event. And there's lots of people out there. So, do you have any questions? Yes. The Youth Aware Mental Health. Yep, and that's a YAM. The YAM is the acronym for it. For YAM, the treatments, no, the schools. Let me see. The Treatment Scout? Treatment Scout? No, not Treatment Scout. It's the website. Okay. The Research and Recovery, the MSU's Research and Recovery Program. Oh, okay. So that's in Bozeman. And that really is where they do research on brain health. They do research on Alzheimer's. They do research. It's just. Okay. 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 Oh, it's called the In Your Own Voice program. In Our Own Voice program. Yeah. Yeah. It's a really, really good, and family to family, the family to family program, if you have a loved one with mental illness, like I have a loved one with mental illness, and I went through the family to family program, and it absolutely changed my life and my relationship with my loved one. I mean, these programs are really, really good and beneficial for people. So it's kind of exciting. It's exciting work, and because you feel like you're making a difference. And I just to kind of talk about the YAM program again. YAM is, I was just on an international website before this, or web call before this, we were talking to people, and that created YAM in Sweden, and we got a lot of trainers from different countries on the call. In the United States, YAM is in Texas, Idaho, Montana, and Baltimore. So it's only in like 4 states in the United States. Um, and in Montana, it's being provided in 30 schools across the state. So, and I think Butte was one of them. I don't know if they're doing it in Butte, like since COVID hit. If they've gotten back into the schools yet, but it was one of the schools that was willing to have the prevention program. So, yeah. Did you guys have it there this year? Oh, okay, the census suicide. Yeah. In Helena, they do suicide prevention programs for every age group. Like they have one for freshmen, which is YAM, SOS for the juniors. I don't know what the sophomores or seniors get, but yeah. One more. Do you have one more question? Sorry. All right. Thank you very much for having me.